Hello, everyone. Welcome to Perfectly Healthy. We have an exciting guest tonight, Dr. Zraiqat. He is a biological dentist. He is my personal dentist, and he treats a lot of our patients that come from all over. I don't know where you are and what time it is, but we want to welcome you to the Perfectly Healthy podcast. I encourage all of you to send a message to your friends, your family, so we can spread the word of health and transforming the future of health and humanity to everyone around the world. So thank you for being with us this special time, wherever you are. So Dr. Zraiqat is a biological dentist, and I'm going to have him explain what a biological dentist. But what makes Dr. Zraiqat unique is his naturopathic experience also. He's a no-nonsense dentist. He's going to tell you, identify your problem, tell you what you need to do, and try not to make it such an overwhelming experience. So Dr. Zraiqat, can you explain to our special guest about what a biological dentist is?
Yeah. Hello, everyone, and thank you, Dr. Connealy, for this beautiful introduction. Biological dentistry is basically, I've always believed that dentists should actually go to medical school before they become dentists, and dentistry should be a subspecialty of medicine because the knowledge of the body is very important, and the mouth is part of the body, and the same blood that flows and goes in your heart, liver, gut, it's the same blood that goes into your teeth. And anything vice versa also, anything that goes inside your teeth, it goes inside your body. It can affect any part of your body. This is the essence of holistic dentistry and holistic medicine. Basically to acknowledge the orosystemic connection, how the mind, how the teeth, what's in the teeth affect the body and the other way around. Basically, in a nutshell, this is the most important thing. I believe everyone who is a biological dentist should pursue, or who wants to be a biological dentist, should pursue a lot of knowledge in medicine. And a naturopathic degree would help a lot, even if you can't practice it. But the knowledge is important in order to really be able to help people, or to help the holistic MDs that you deal with. You don't have to do holistic medicine or functional medicine. You can do your part, but understanding the importance of what you do will make you do it even better.
Right. In my book, The Cancer Revolution, I have a special section on the mouth. And the mouth is the gateway to the rest of the body. And actually, there are lots of papers in the literature now that talk about how, oral infections, how infected gums, how infected teeth, how mercury fillings, how these things affect. So it's not something new anymore. And there's a great book, if you want to read, written by Dr. Levy, called Hidden Infections. And it's interesting because a lot of people really don't understand how important the microbiome and the balance of the microbiome is. And if they have an infection, how serious, deleterious it is to the rest of the body. So let's take, I hope I'm pushing.
I want to add something. There is a theory that was, I don't know if, I think they won the Nobel Prize for it. It's called the focal infection theory.
Uh-huh.
And it was recognized, but sometimes it surfaces, sometimes it goes hidden. But basically, it recognizes that an infection anywhere in the body, including the mouth, it can actually go somewhere else and affect. And the guy won a Nobel Prize for it. So, it's established. And the science, there is a lot of science out there. There is a science that links a lot of stuff like toxicity, jaw infections to a lot of diseases, even bacteria under the gum. We're talking about serious diseases. We're talking
Very
Alzheimer's,
serious.
and the science is out there, actually.
Yes, that's true. It is. And the doctors typically, unless you're going to conferences and lectures all the time, because what's in a textbook is old, what's in a lecture is new and won't become in a textbook until about 20 years down the line. So let's see, here's information about Dr. Zraiqat. You'll get this because it will be sent out later. So why don't you talk about the special way of removing mercury fillings?
Well, basically, the mercury toxicity, like people have to understand that it's already been established that the mercury in the mercury fillings, which is 50%. By the way, the amalgam filling, it's called amalgam filling. Some people refer to it as the silver filling. Usually, when you amalgamate like metals together, you add them, you bind them, you put pressure on them so they can excuse me, so they can actually have a physical bond to it. And when you do that, when you have if you want to call it by one ingredient, you should call it by the ingredient with the highest percentage. The mercury filling, the amalgam filling, has 20% silver and 50% mercury, a little bit more even. It has tin, copper. It has a lot of stuff amalgamated together. It should be called the mercury filling, honestly. But the amalgam, the mercury in there, it's been actually associated with a lot of diseases, and especially Alzheimer's. It's been surfacing this thing because they found out that the mercury actually can affect the brain and in producing the amyloid. So basically, it is proven, the science is there. When you understand how important, when you understand the science behind it and how it works, and that the mercury is one of the rare elements that can actually exist in as a stable form, as gas, as vapor, and as solid. So when you understand the effect of it and how a small part of inhaled mercury that you can get exposed to can go into the brain, other tissues of the body, you will actually be really careful when you're taking it out. But you have to really believe in this and read about it in order to be sure to not expose any of your even employees or people who are in the waiting room, or of course your patient, and yourself too. So you have to really protect the patient. I usually like to work with Dr. Connealy so she works with the patient in terms of preparation. I ask my patients if they can do vitamin C IVs before they can come to the center here, and they can do the vitamin C IVs. It's a good practice before you do that. And we give some supplements inside before, like in the office before we start, some things that will help bind the mercury if there is any exposure. But there are so many different techniques that you can do that. And the most important goal of all of those techniques is basically to decrease the exposure. For example, instead of shaving the filling and making it produce a lot of vapor everywhere, all around the mouth and in the room, you can cut it in pieces. That's one of the ways that you can minimize the exposure of the patient. But you have to really be careful. You have to use big amounts of water, and you have to make sure that you rinse the mouth really well, and you have to use a lot of separation, a big vacuum. So it's really, when the patient comes, it's as if they look like they can't recognize themselves if they take a picture, because they're all covered completely. So you really have to be really careful when you're doing that. It's a very serious thing.
Yes, typically I know that I had mercury fillings because that back then that's what they did. And now most dentists are not implanting mercury fillings. Now there are doctors that do, but I know when I had my children, they did not have mercury fillings. But I also sought out a dentist who was not going to put mercury fillings in a children's mouth.
They still actually do it up till now. They're
Yes.
putting it in kids' teeth up till now as we speak, and in pregnant ladies.
Yes.
Although with all the precautions.
Yes. So mercury is one of the most toxic metals I can send you a very good handout on all the things that mercury does, which is what I do. Is I give a handout to the patients so they understand how serious having mercury in your mouth is, and it's being every time you chew, it releases mercury. There's actually a video on YouTube that you can see the mercury being released.
Yeah, it's called smoking teeth.
Right, exactly.
Smoking teeth. Yeah.
So this is very bad. And interestingly enough, mercury, Dr. Zraiqat talked about the brain, but also mercury has an affinity for the heart and contributes to atherosclerosis. So it's very important that we remove all metals, just not mercury, but get mercury removed from the mouth. And why don't you talk about the battery effect that metals cause too?
Yeah, but before that, I don't want anyone to get frightened or scared.
Yes.
We have to understand that everyone is different. This is the essence of what we do. You can see some patients having the mercury fillings, and they don't have any symptoms or any issues. At least not when they're young. Sometimes, because the body, it works in a really good way, efficient way when we were young. So even if we're exposed to a lot of stuff, if we get exposed to the same amount of stuff when we're a little bit older, we can get diseases. The body cannot handle the stuff as good. So we have to understand that the effect, if you're doing a mercury filling and a mercury filling removal, you have to understand also who you're dealing with. There are a lot of factors that you can test before if the mercury fillings are causing you a big problem, or are they a risk of causing you to have Alzheimer's, for example, like the APOE gene. If you have it's a gene basically that allows the brain to detox itself from, it helps the brain. It carries all the toxins from the brain into the spinal fluid and through the blood-brain barrier, and then it goes to the blood so the body can take care of that. Some gene mutations in the APOE, and by the way, you can be APOE2, APOE 3 or 4,
yeah. And
the difference between them is the sulfate group. The sulfur group on the APOE, for example, has 2. The APOE 3 has 1. The APOE 4, which is the most dangerous one when it comes to heavy metal toxicity, doesn't have any sulfur group attached to it. So that, because it's used to bless you, it's used to actually detox. So that's why the effect from one person is more than the other. That's why it's more crucial for some people, like the MTHFR too.
right.
So other than the fact, I mean, and we can talk a lot about this, but there are a lot of literature out there that you can go through about the mercury fillings. But going back to Dr. Connealy's question about the oral galvanic, we all know that the body is electric basically. We get brain signals there, and they produce microcurrents, very small currents. Everything, even when you do the heart, it's like you do an EKG, which is the electricity of the heart. So we all know that we are energy, and we are actually also electricity. So when you put different metals in the mouth, what you need to know is that when you mix those metals, the saliva can work as a solution where it can transfer those electrical currents. And especially if you have gold and other metals in the mouth, you can get something called oral galvanic. A lot of problems are related to that oral galvanic. Basically, every metal, it corrodes, and you get exposed to that metal. The more it stays in the mouth and the more you use it. Having an electrical current between two different metals opposing each other will increase the corrosion process, which will expose you more. Your saliva will have more, your body will have more. So having one metal is not good, but it's better than having different metals in the mouth. And we're talking about, when we say metals, we're talking about the titanium implants too, the gold crowns, the porcelain fused to metal crowns, and the mercury fillings. They did a study also. They found out that the amount of the current that is produced actually is enough to power a clock. If anybody remembers the potato clock experiment, where they were able to put different electrodes, and they were able to power a clock. Actually, my daughter did that experiment in school for her project, and she put a gold crown and connected it to a titanium, and it was able to power the clock. That amount of current between those two restorations is way much more than your electrical current in the brain, and it can interfere with a lot of stuff. Some with your heart, because it's electricity, with your brain,
Nervous system.
with the nervous system, exactly, and it can also cause some things that you can tell if you have oral galvanic, if you have metal in the mouth. They present themselves as if you have a metal taste in the mouth. If you have any bleeding gums sometimes that you cannot control even after going to the dentist. Sometimes even forgetfulness. Of course, it can be attributed to so many other things, but those are one of the signs and symptoms. Even burning mouth syndrome, or a burning sensation or tingly sensation on the tongue. That is all related to oral galvanic. I don't believe that the body was made to have metal in it. If it was made to have metal in it, we could easily, if we can't swallow it and eat it and digest it, then I don't think we actually should have it in the mouth.
Right, I agree. Okay, here we are.
Well, that's a nice picture. Let me talk about this is a lot of the things that are very important in holistic dentistry. Huggins, he's one of the pioneers. Hal Huggins protocol, which is the protocol he came up with. The protocol. I met him maybe 6 years ago in one of the conferences. Very interesting guy. So basically, you have to incorporate at least some of those in order to have a really functioning holistic practice. You have to study all of those, among also homeopathy, Chinese medicine, acupuncture. But the no fluoride, it's I'm sure most of you guys know about the fluoride.
It's made news recently, quite a bit of news.
The problem is that the amount, even the amount that they say it's safe, let's assume it's safe, we're getting a lot more than that.
Yeah, right.
In the water, because whatever we drink, there is a small amount that is allowed for. But also, they came up also with fluoride, even pills, fluoride like paste that you can put on your teeth, which have a lot of concentration. So it needs to be further studied about the effect on the nervous system for fluoride. Root canals, it's a big subject.
Yes.
A lot of controversy about that. I believe, again, everything has to be taken in context. Everything has to be taken into consideration when you're talking about root canals. But there are some studies out there. They did some study on teeth that they did a perfect root canal using the conventional method. And they found out that there is something called lipopolysaccharides, which is an endotoxin that's produced by the bacteria. They found out that the conventional method, doing a root canal with the conventional method, could not eliminate lipopolysaccharides. So they cannot eliminate it. And they did another study where they used ozone and laser. And they found out that it's better, but they could not also eliminate completely lipopolysaccharides. And there's another study, on the other hand, that's got nothing to do with root canals, about the effect of lipopolysaccharides in esophageal cancer, in autoimmune diseases, and the conclusion was that it's involved in the initiation and migration of that. So I think further studies need to be done to link those two studies. Is there a link between, we have A linked to B, and then B linked to C is C linked to A. So, that's why we prefer to find an alternative. A lot of people also, they're diagnosed with root canals and they don't really need root canal. But this is the dilemma when it comes to when you go to a dentist. The common trend is that if you're in doubt, if the dentist is in doubt, to do the root canal for so many reasons, for a safer practice. Basically, if the patient has pain and wants to get out of pain, you can do the root canal, everyone is happy. If you think that you're gonna try to save that tooth and the patient pays a good amount of money to try and save that tooth without a root canal, and then you come back and then you need the root canal, then everyone is upset. The patient is upset. And so that's why the trend is to do the root canal. From a holistic point of view, we try to avoid it. So if there is a 50% chance, sometimes even a 40-60% chance that we can save it, we'll go for it. Sometimes even less, but it depends. So the idea is to try and save the tooth. There are so many ways that can give you the upper hand to preventing a root canal that can be done in a holistic practice. So we try to go for that.
And tell them why you use ozone.
The ozone is basically, it's O3 for you guys who don't know what ozone is. It's basically, it's made by a machine that uses some a technique like lightning to break the oxygen. So it's basically made of oxygen. And then those two oxygens, they meet among other oxygens and they form O3, which is the ozone. And the ozone layer, it covers the earth, and it helps actually. It clears the air from. It's a good thing, because a lot of people, because of the ozone layer, they think ozone is bad, but it's a good thing. And the problem was that we don't have enough of it in around the earth at a certain point. But the ozone, when it's used in dentistry, it's used as a disinfectant. It has so many other effects also that can be also combined with dentistry and medicine. But if we're talking about the disinfection point of view, it's 10,000 times stronger, one molecule of ozone, 10,000 times stronger than the chlorine molecule, anything that you have like based on chlorine. And it's made of oxygen. So there is no real side effects of it. It's not a chemical, and it's way much more effective. So that's why before we place anything, before we place a filling, a crown, or around root canals, or when we do cleaning, we use ozone water. The water comes out of the handpieces, ozonated water, and it disinfects as we go. Because most of the problems that happen with a filling, when you do a filling or you do an extraction they come from bacteria. So if you really disinfect it well, you're not even gonna have problems after you pull the tooth, after a surgery. Imagine after you put a crown. So it gives us the upper hand. When you do a filling to try and avoid a root canal, the idea, decay is actually the loss of minerals. So you lose the minerals in the tooth because of the bacteria. So the tooth becomes soft and it changes color. So sometimes when we're removing the decay, if we remove one more layer, we're gonna get to the nerve, and we're gonna risk either exposing the nerve or getting too close that the tooth will need a root canal. But if you remove enough, but you don't remove everything, and you leave one small thin layer that will protect the tooth, and that layer will have bacteria and will have demineralized tooth structures, like a soft dentin, and you put a lot of ozone in it, and the tooth is alive. So what you did is that you killed all the bacteria, and then you have a sterile area with demineralized tooth, and the tooth is alive, so it will actually remineralize that area. So when you use ozone, you really decrease the chances of you getting or needing a root canal or getting too close to the nerve, where you're risking the fact that the tooth might need a root canal. It's fascinating. I don't think any practice should do without it.
Right,
it
that's
helps
true.
a lot.
Patients Here, no, because we use it a lot. So you want to talk about your history?
Okay, so I mean, sometimes you feel that things were meant to be. So when I finished high school, I got a scholarship to go to medical school. And when I finished high school, I was 18, so I didn't really. I always wanted to be a dentist, but to get a scholarship to go into medical school, it was too tempting, and I got into medical school. I almost finished medical school. I remember which was very interesting, because I remember in the fourth year we got the introductory course before we went to the hospital. I don't know if you remember that course, but in that course, it was really fascinating and I really enjoyed it. And I still remember how the book looked, actually. Because basically it talks about how to prepare you to go and meet patients and talk to them. So the bottom line of that course was to be able to know how to talk to the patient, how to ask the patient about all the history, all the pain, the onset, the duration, like everything in details about the symptoms, and with the knowledge that you have in mind to try and guess. It's like a puzzle to try and guess what the patient, but you have to talk to the patient. You have to really explain, like to get as much information as you can. It was really, it's like a puzzle. It's fun. It was fun. But then I went to the hospital to actually to practice this. And I almost finished the fourth year. I finished the fourth year just the last 2 weeks. I decided that I've seen enough, and I wanted to transfer to dental school. I went to dental school, I finished dental school, and then I came to the States here. I got my licensing at the USC, and I've never placed any mercury filling. I was always trying to think of something different. But then I saw a TV program for a lady that was here in the States, and she had a biological dentist on her show. So I give her a call. I've known her. So I give her a call and I ask her, I'm really interested. I want to talk to this guy. So she gave me his cell, and I speak with him, and he told me to go to the IOMT, and that will open up like so many things. And when I went to the IOMT, I met two great doctors there that made a college. It's called the American College of Integrative Medicine and Dentistry. And that's when I went, and actually it was almost a 2-year program. In that program, you learn homeopathy, Chinese medicine, acupuncture, toxicology, even you study herbs, and you go back and study anatomy and physiology and all of that stuff. Adding that to what I learned in medicine and what I learned in dentistry, everything started to make sense. Everything fell in place. And that's how, it was not planned, but that's how everything, when you get this knowledge, because I really had a passion about that. So
that's awesome. You found your passion.
Here.
So what's the difference between going to a regular dentist and you?
It's the approach, the individualization. Basically, everyone. So we really we talk when we do the appointment. We really go through deep into the health history, even the social history, their life. Everything is connected. This is part of. A lot of people are even from an emotional problem. They can be sick. You have to understand also if their priorities. What are the? If you have a patient and they have a lot of health issues, your whole treatment plan will change. Your priorities will change. So we really try to personalize the treatment plan for the sake of the patient. We have a lot of things that we can do to personalize that, like the biocompatibility testing, which is something that everyone is different and everyone reacts to every material in a different way. So we can do that test. We can do a DNA testing. We can do a microscopic testing for the saliva. And of course, we have the cone beam X-ray, which will give us a more detailed look of the teeth. But I wanted to say something about the CBCT, because everywhere you go, or if you go to a post on Facebook, they tell you that holistic dentists, they have to have, you have to get a CBCT. I really don't agree with that 100%. It's informative, but you have to take the whole picture, because it's 15 to 20% more radiation, that's minimum, than the X-ray. So sometimes we see what we need to see on the X-rays. We don't need anything else. Like the CBCT will only show us the same thing that we saw on the X-ray magnified, but we already know that it's there. So yes, a lot of people need it. It's needed in a lot of cases. It will show a lot of things that the X-ray doesn't show, but sometimes you don't need it. That's just for patients to keep that in mind. What else do we do? Of course, the ozone, and the most important thing is to have a relationship with, to have the understanding of medicine, to know that this patient now, you have to refer him to a functional MD. If they don't have a functional MD, you have to work with one closely, because you by yourself, you cannot do it as a dentist. And I believe that also the MD, also, not a lot of people understand this like Dr. Connealy does. And I know a lot of holistic MDs, honestly, around Orange County. But not a lot of people understand this, and it's very important to have the doctor and the dentist work together on this.
Right. Yeah, so we've talked about this earlier, how the mouth is connected to heart disease, diabetes, cancer. That's why we always do a dental history on all of our patients.
I mean, everything is related to one thing. Like, for example, Mercury, like you said, the heart, also the thyroid, because of the affinity to the iodine, and also to when we're talking about root canals, we're talking also a lot of concern with rheumatoid arthritis. So. And we're talking also dementia, Alzheimer's, and a lot of, and those are all, there are a lot of studies that,
it's a real problem. Yeah. You talked about this, about the mercury and how it's toxic and everything. So I think this is important about the root canals and how they are an infection,
So basically, when you do a root canal, basically you kill the tooth. Every tooth is an organ. It has its own blood supply, lymphatic, and nerve supply. The blood goes in there, gives nutrients, and then it comes out, takes the toxins through the venules, the small veins. I mean, it's like any organ. So when you have a root canal, basically you kill the tooth. The tooth becomes like mummified, and to leave that in your body, I don't think there's any other organ that you can leave dead in your body except for a root canal treated tooth that is allowed. Usually, when something like that happens, a lot of people it depends on their health, it depends on their structure, their genetics, but I don't think there is a very safe one unless it's done really perfectly, and it can be safer than other ones. Before, when I went to school, I believe 25 years ago, I believe they used to do the root canal in steps, which would actually be safer, because they used to do the root canal open, clean. I remember they used to actually put the paper points and smell it. If smells like infection, they would seal it and come back again. They would do it again. So it was done on visits. Nowadays, everything, it needs to be done fast. So they go ahead and do it in one visit. Basically, the dangers become when this root canal gets infected, when you have infection around the root canal. What are you going to do with it? What are the approaches? The approach is basically either you have two options. When you have an infection of a root canal treated tooth, either to go and send the patient to a specialist to do something called a retreatment, or to pull the tooth and do an implant, like a ceramic implant. I myself think, I mean, there's a lot of discussion about this. Some people say this, some people say that. Some people even that are not holistic say it's better to pull it, because what if it gets infected again? Like, what are you going to do? And the chances are that it will get reinfected. So even not a holistic approach, without a holistic approach, I think a lot of people will elect to extract that tooth. But from a holistic point of view, I think that the only approach should be is to take that tooth out and put a ceramic implant. One of the problems of the difference between, I mean, the implant is dead, the ceramic implant is dead. But what's the difference between it and a dead tooth with a root canal? The difference is if there is some bacteria that's left in there, everything surrounding the tooth has blood supply. So the bacteria cannot go in there because there are antibodies, white blood cells that go and feed that area around the tooth. Except for the tooth doesn't have any blood supply. It doesn't have any defenses. So this bacteria that's left in there, even in small amounts, it can choose a time where your body is weak, and then it can feed off of that organic structure. And that's where the difference, I think, it lies. It can feed off and it can grow. When there's an implant, it cannot feed off of that because it's not organic. So the chances of you developing an infection around an implant tooth is, I think it's way much less than with root canal.
Mm-hmm.
So this is the two teeth that have root canals, and you can see they're not done good. So they're not done well. Basically, this one has an infection. This one is not done. It's not condensed well. It's not done to the end of the root tip. So to begin with, they were not done properly. But all of this area that you see is an infection, and the bone usually looks like that. This is how this area should look like. But once you lose the bone due to the infection, this whole area starts to look like this. So when we take out the tooth, it's not about just taking the tooth. Anyone can take a tooth, but the extra steps that you do afterwards, which is basically, this is a curette, a surgical curette that the tooth ended here and here, but we had to go and scrape all of this material out. Now there is another picture of the stuff that I got, but I think Ryan thought it was
Too much.
But it's if you see that, I mean, it's there's no way, if you see that picture, there's no way that your body could have taken care of that. And the patient had very serious illness. And actually it was related, the illness was in the organs that were in the midline, and those are actually connected to the midline organs. And it's a theory, but I mean, immediately when I saw that patient, I told her that we're going to have to remove those as soon as possible.
Yeah, and that does a number on the immune system too.
Oh,
so.
Everything, I mean.
Right. So here, this is the most important thing. The
Okay.
action plan.
The action plan. The most important thing, I mean, if somebody tells you what's the best thing I could do for my teeth, this is what I tell everyone. It's not a toothpaste. It's not the floss. It's what you eat. It's the most important thing, because if you go to some areas where there is no toothbrush or toothpaste or dentists, and you look at their teeth, a lot of them, they don't have any bad teeth or decay. Basically, eating processed food, eating sugar is what causes the problem. So if you avoid any processed food, although it's really hard. So that's why when you're living in at this time here, in a lot of cities, there's no way that you can avoid that, but you can decrease the effect of it and add the brushing and the flossing, and most importantly, also going to the dentist for a routine checkups. A lot of people, they do it every 6 months. I like to do it every year if needed. The checkup X-rays, sometimes every year and a half. We try to minimize that, but the cleaning has to be done with the hygienist. Has to be done every 3 to 4 months. You should aim for 3 to 4 times a year. But the most important thing, again and again, is what you eat. Eat in season. Eat what grows in here, and avoid at any cost. Avoid any sugar. When we went to school, and this is very important, we were taught a theory that basically you get decay if you eat food and you don't brush your teeth, and it gets fermented and it produces acid. It eats away the tooth, causes cavity, then you fill it. But that theory doesn't make sense for everyone, because it's not the case for everyone. Some people brush their teeth and they still get decay. Some people don't brush their teeth as well, and they might not get decay. So that's why this theory, and they still teach it up till today. But I think what happens, there was another theory going, which is that every tooth, remember when we talked about that tooth has the artery, the vein, and the nerve and everything, it goes through the root, and it goes from the end of the root, it goes up. And when it goes up the tooth until it reaches the enamel, this movement of the fluid, it works as a cleansing mechanism. The tooth is like a fountain. It pushes everything out, along with providing the nutrients to the top layer of the tooth, which is the enamel. They found out that the minute the blood sugar gets elevated, when you have a sugar spike, even if you didn't eat, if you're diabetic,
or pre-diabetic,
or even if you drink something like through a straw, that thing when you get the sugar spike, it stops that movement of the fluid from happening. So all this defense is gone, and the tubules of the tooth are open now. They don't have any fluid is going to push the bacteria out, because the mouth is full of bacteria. So then it's like a highway for the bacteria inside the tooth. So bottom line, if you get a sugar spike, so the sugar is actually the cause of all diseases. Dr. Connealy knows it's, it affects, if it does that to the teeth, imagine what it does to other organs, because they all work the same. So I think that's one of the most important things. Cut sugar completely, eat in season, what grows in here. And you have to find a biological dentist. But if you can't find a biological dentist, always go and get a second opinion. If someone tells you that you have a cavity, always go take a second opinion, sometimes even a third opinion, because once you drill on that tooth, even a small cavity, you're stuck with that tooth for the rest of your life. That's what I tell parents. Do not do any filling on your kids' teeth until you take a second or a third opinion, because it starts with a filling, and then it's a larger filling, then it's a crown, then it's a root canal, then it's an extraction, then it's an implant. And that's the process and that's what happens. But the thing a lot of people don't know is that maybe 85, maybe to 95% of the people after age 25, it's almost impossible to get decay, like new decay, on a tooth that hasn't been touched by a dentist. So most of the people that come to me through the years, in their 30s, 40s, 50s, 60s, until they're 100, the problems that they should have are either gum problems or problems with the work that's been done. But the teeth that have not been touched by a dentist usually don't have any problem, unless in those small percentage of people where they have a disease that causes them dryness of the mouth, or they take drugs that causes dryness of the mouth, or they have a connective tissue disease that affects that. But that's a small percentage of the people. So the majority, when you go to a dentist, you're not going to have new decay, but you will have problems with the work that's been done. So always, before you have like anybody touch your teeth or your kid's teeth, always take a second opinion, because once that's done, it's done.
Right. Yes. Very good. So we're going to open up to questions. So this is a good one.
This is a dilemma. The retainers. The retainers are either stainless steel and they have chromium and nickel and
Right.
all of that stuff, and or we have the plastic retainers. Now we have BPA free. We have new brands that they talk about, but they all have something in there that we shouldn't have. So there is none, unfortunately, and I've looked. There is some innovations people are trying to find a ceramic retainer, but they're too bulky and they fracture easily. Same thing as the space maintainer for kids. We tried everything. We tried even the ceramic ones, and they break. So that is a dilemma. So if you have braces and you remove those and you don't wear retainer, the clear ones, your teeth will shift. And the teeth will shift because that's the way the mandible grows. With time, the mandible actually constricts. That's why in cartoons, when you see cartoons, when they want to put a very old man, they put him with a pointy chin. That's exaggeration of the actually what happens. So instead of having a circle like this, now you're having something like that, and the teeth have to fit in there, so they have to overlap. It's gonna happen. So it depends on your priority. If you ask me, I would let the teeth go where they want to, and I'll take extra care of them. But I wouldn't force the teeth to be in a place where they don't want to be, and it's not with the anatomy of the mandible, because I think that creates another tension somewhere else in the body. And if you're going to do that, you're going to need to probably do adjustment, see a good chiropractor that will do adjustments, because it's all connected. So you're forcing the teeth to be in a place where they don't naturally want to be.
Right.
So basically it creates some kind of stress. So unfortunately, no. CT scan, we talked about the CT scan. You do it once. If you've done the wisdom teeth extraction, and 2 years down the road, 3 years down the road, you had a CT scan and you were told that you don't have any problem, any jaw infections, then you don't need to do it again, unless something happened. Yeah, that answers it.
And where did they get a CBCT?
You have to go to a radiology center. We have one in my clinic. We have one. It's a brand new one, actually, state of the art. So the radiation is even less. So they all range between, I think, like $250 usually for a CT scan. So you can get that. It's better to be done with your dentist, the dentist that you're going to end up with. Because when sometimes you take it at a radiology place, it's hard to open it. When they send it to you, you cannot open it. It needs a software, so it creates a lot of problems. So it's better if you have a biological dentist to take it actually at his office. Had 5 root canals, 1 tooth removed due to infection because it's the backbone. Did not replace it.
3.
So if you were told by your dentist or your biological dentist that you have no infection in those teeth, then you have to look at the whole picture. If the patient is healthy, I'll keep an eye on those teeth. Taking 4 teeth out is a big decision. As we said, those are things that we still need to look into. If you have one root canal, hopefully now I think I'm optimistic that things are going to change. For maybe we're going to start to look at this stuff in depth. But I would keep him if you're healthy, and I would recommend that your biological dentist consult with your functional MD. That's how you can get to the right decision, because we have to see it. We have to see who gave you the impression that they don't have any infection, they don't have anything. So basically, the bottom line, biological dentist and a functional MD will help you make that decision. What do you suggest replacing with? If you decide to pull, then for sure ceramic implants, but every case is different. So we have to look at the x-rays, we have to look at your bone levels, because you have different options. The best one would be a ceramic implant. If your case allows, your health and your bone, you have a different option of doing a bridge, but you have to take into consideration that with a bridge, it has its disadvantages. It's very convenient, cheaper, but you have to take into consideration that you have to shave the 2 teeth on each side. So again, if the teeth already have crowns, then that's not really a disadvantage. But if the teeth are not touched by a dentist, then that's a big loss to try and shave those teeth. And you have a third option, which is just putting a partial in there, but don't leave it, do not leave an empty space. Everything will move, and then it's like a domino effect, because the teeth go together like a lock and a key. And any small movement, it will start to affect all of the teeth and your body too. So your body then will need adjustment. Cavity filling. Okay, this is important, because removing the mercury fillings in a safe way is something, and replacing the mercury filling is something else. So when we remove the filling, we're going to end up with a cavity, the cavity that was designed for the mercury filling. The mercury filling, the design for it to do the cavity, it's very accurate design. It takes a lot of, it has a minimum depth, a minimum width, exit points, exit angles. It's very important for that mercury filling, and that's why they stay for 30 or 40 years. Nothing happens to them. But now you have a cavity that is designed for the mercury. What are you going to do with it? You're going to put white, but the cavity is made for the mercury. So you have to adjust the cavity design in order to take a totally different material that has different even bonding mechanism, and it has a different physical properties. That's one of the problems that people, when they remove mercury fillings, they end up with a root canal, because they put a filling and it's not done properly in terms of design, and they end up having like pain every time they bite, and they go to the dentist, they adjust, and then at the end of the day they end up needing a root canal. It happens a lot, and I see it a lot. You have to do a modification for the design in order to take the white, and the white, as compared to the mercury filling can be put in one piece, just one time. The white cannot be put in one piece. You have to do layering technique. This is where biomimetic dentistry is a study. It's basically a technique. So a scientist, I believe he's French, his name is Pascal Manier, but he used the USC labs, and he actually did the same studies that were done on the mercury that made that filling last for 30 or 40 years, but he did them on white. So it's the only science, and this thing is taught only at the USC, the biomimetic dentistry, as far as I know, and or you can take courses afterwards. The problem with it is that it takes way longer to do a filling, and it's very technique sensitive, but the results are way much better. It can last a white filling. Usually, even insurance companies, they pay for a white filling every 2 years, because they know it's going to fail every 2 years. But every time it fails, you're going to have to even take more of the tooth structure. But if you do it in a biomimetic way, which is not holistic, biomimetic got nothing to do with holistic. Biomimetic is a technique. If you do it in a biomimetic way, it's guaranteed to last way much more. How much more, we don't know. It depends on your bite and what you eat and your habits, but it's guaranteed to last way much more than a regularly done filling.
About taking
What is it?
blinders and after dentist appointments.
I mean, there are a lot of talk about the anesthesia now. That's why we use the magnet. But also, I think in With Washington Homeopathy, I believe it's called Washington Homeopathy, they have a homeopathic for X-ray. You can buy it. If your dentist doesn't have it, you can buy it. In terms of binders, after you remove the mercury fillings, of course, you have to talk to your MD. I always tell my patients, please do not listen to everything that you hear on Instagram from anyone that heard something, because it can be dangerous. As a simple example, when somebody tells you that you have to take cilantro pills, for example, if you have mercury fillings. Cilantro, it can pull. So I don't believe that you should pull when you still have mercury fillings. So you hear some stuff, sometimes always ask a holistic MD or a biological dentist before you do any stuff. Don't self-prescribe even supplements.
Right. Good question.
If it's done properly, I don't believe it affects the health. Some people are better off if it's always good to save teeth if they can be saved. But if they cannot be saved and they have periodontal disease, I believe that not having them is better. Because a lot of, even P. gingivalis was found to be associated with Alzheimer's and Parkinson's. P. gingivalis, it's under the gum. So I find it that people with dentures actually have less chance of getting any diseases but only if the extractions are done properly. So basically, if your teeth are not savable, make sure to go to a biological dentist where they can take them out, clean the area well, probably disinfect, and put PRP. PRP is really good. Ask about it. It's called platelet-rich plasma, or PRF, platelet-rich fibrin. You can add that in there, and that will allow you to heal well and fight any future infection in that area. But if some teeth are savable, it's better to keep. If you can keep like 2 teeth in each corner of your mouth, in each quad, that will make a big difference. Because once you lose teeth, you're gonna continue losing bone. Once you have a tooth in there, the bone will accumulate. The bone needs to be worked in order for it to continue producing. Otherwise, if you lose it, if you lose the tooth in there, you lose the bone with it. The only way they can get out, if you have that, is if you do a surgery. You have to have a CBCT, and you have to open the area and clean it well again with PRP, sometimes ozone even. For adults that did not do myofunctional therapy, still they can do myofunctional therapy. They can do something called the Alpha Appliance, Advanced Light Wire Functional Appliance. It can be done. We were taught in school that sutures in the skull, they close after age 6 and you can't move them. But when they did the studies, they did them on cadavers, basically. So they close on cadavers, but actually when we breathe, the skull expands. So the sutures, they still have a movement in there. So basically you can still do that, but you have to find, my advice in this situation is, when you work with someone that does those kind of stuff, they have to be working with a DO and a chiropractor. It has to be all connected, because I don't think they can, a dentist by himself, he cannot do the 100% work. So look for a dentist and see if they deal with a DO and a chiropractor.
Yeah, it's a good recommendation. Are there any bind? I don't know about them.
I don't think so, but I think the way to find about, because a lot of people are, we get a lot of calls from patients that they went to a dentist and he was not really holistic, but they advertised and they pushed fluoride and they pushed root canals for them or all of that stuff. So, but when they went, they were under the intention of. So to know, there is a website called oxygenhealingtherapies.com. Ignore the fact for the MDs, I don't know anything about it, but oxygenhealingtherapies.com. Look at the dentists in every state. And you have to look for ACIMD or ACIDM. It's one of those. If they have that sign right next to them, that means they went to the American College of Integrative Medicine and Dentistry, and they studied all of this stuff. They studied herbology, Chinese medicine, toxicology, anatomy, physiology. They studied all of that stuff, and that's only available if they are certified by the American College of Integrative Medicine and Dentistry. So the website is called, to answer this question, go find a list, you put your zip code, you find the dentists that have the ACIMD right next to them. I've been with them for so long, but they put them alphabetically. So my name is, unless it was ZZ Top, maybe I'll be ZZ Top.
Maybe you
my
should
name
put it under Amen.
Yeah, they go by the last name.
Right.
They go by the last name. So,
Right.
but yeah, and then you call them and see who's the closest, and then you see if they take insurance. There are different ways. Some people are in network, some people are out of network, but it's hard to find somebody in network because the fees of the insurance are so little to do such quality dentistry.
Right.
But maybe they can be out of network like we are, where we actually they pay you, so they can use your insurance, but you pay them, I think, their fees. Yeah.
Right. Yeah, because the way the insurance works today is they are designed to not pay. It's like 40 years ago when I started my practice, they paid the doctors 100% of their fee. Now you're lucky you get 20% of the fee if you bill insurance. So it's not a really good system. So
You need to hire 2 employees just to deal with that.
yeah, yes, exactly.
And they're
Every,
gonna
you're
waste their
working 12,
time.
14 hours a day. Yeah.
Exactly. And at the end of the day, I mean, I think have you seen the movie for, it's called Bowling for Columbine?
No.
It was, I think it won an Oscar. It was back in the 90s, I believe. But it talks about that. It was back then, it was like that. So some people were paid extra to deny claims.
Oh yeah, no, yeah,
You know?
exactly.
So that's why, I mean, it's hard.
Right. Very tough.
And hip replacement, okay. Basically, like any tooth, it makes it. If it's an old root canal, it makes it more dangerous. So you have to be pre-medicated based on. But that's something that your doctor has to go about. They found a lot of bacteria. If you have a joint that failed, they found a lot of bacteria in the mouth in there. So it's risky. So they recommend 2 grams of amoxicillin prior. But the problem is 2 grams, like 500 milligrams. It depends how big you are, how tall you are. You know, everyone, the clearance. So I would suggest to ask your doctor, your MD, about this, because there is a risk of infecting that tooth. But if you take the pre-medication, I think you should be okay, even if it's a root canal treated tooth.
Right. Yeah, I think so too. What to do if pain persists post-cavity filling? Are curing light-saving cavity use? And finally, what other root canal in order to not disturb tooth meridians?
Okay.
That's a very smart question.
Yeah. So, and they didn't put it for me, so I. So if a pain persists, we talked about that. I just talked about that because sometimes the filling sometimes is not done properly because they put a white filling in there, but it's not done in layering technique or using the biomimetic principles. A lot of dentists, they don't know the biomimetic principles and they do the filling based on the amalgam filling principles. So you end up having issues with it, and a lot of people end up with a root canal in it just because it was not done properly. It was done to exactly like a mercury filling. But there are also other factors. In your mouth, that the teeth that bite, your teeth, they go like a lock and a key. And only when you close your mouth, only the front part of the back of the lower molars should touch the groove of the top. The other part, the inside part, should not touch. Even when you move your jaw to chew, it should not. Now, this is occlusion. This is bite. This is not really done. It's not taught fully in school. People have to go and further study it after they graduate, the TMJ and the occlusion and the bite. So basically, I get a lot of patients who have problems with the tooth every time they chew, and they go to their dentist, and the dentist, they keep trying, and then they tell them, you know what, the tooth needs a root canal. They come to me, and it takes 2 minutes sometimes, just 2 minutes, just to remove areas where they're biting and they shouldn't be biting, and they go on, and like it's gone, like the pain is gone. But you need to know this stuff. So, and sometimes they need root canal if it was too close to the nerve. So if you have post cavity filling, and the curing lights, yes, they're safe, but you don't have, but you can't look them. You cannot stare at them. The alternative to a root canal, in order to not, there is no alternative to a root canal. So basically, if the tooth needs a root canal, for sure, this is the question, if it needs a root canal or not. But if it does need a root canal, the only options are either to do a root canal or extract the tooth and put an implant or a replacement. There's no option. You can save one that might need a root canal. But if it definitely needs a root canal for sure, which is basically if you have a spontaneous throbbing pain that gets worse at night, and it's diffuse, it's like you cannot pinpoint it, then those are signs and symptoms of a root canal. If you have sensitivity to cold, to biting, that's not really an indication for a root canal. It might be, but it's usually not.
Well, thank you. That's wonderful.
Thank you.
This was good. I think a lot of patients had good questions, and I think it's a lot to think about when you make decisions. You want to make educated, informed decisions. I think for any condition, but your mouth, like I said, is the gateway to the rest of your body. So you want to make sure, like Dr. Zraiqat said, get multiple opinions to make sure you're making the right decision. And it's so interesting. I feel like what we did yesterday, we don't do today, because medicine and dentistry is constantly evolving, and we're trying to always find the greatest, latest thing. And if we're still doing what we did 10 years ago, that's old. It's become obsolete. So do your own research. I always tell patients, really go do their own research, go study about what needs to be done, go get multiple opinions and consults, and do your own homework. It is your mind, body, and so that you have to really make the best decision. So you're not like, a lot of times I see patients and they're like, oh, I shouldn't have done this. Oh, I should have done more research. Oh, and so hindsight's always 20/20 for all of us. But I think if you do, research, study, do your homework, and look at all the possibilities that need to be answered, whether it's for your mouth or for the rest of your body.
Just I want to say something about, I was watching the news today, and they were talking about some new innovation about finding cancer through a blood test.
Right.
You've been doing that for
a long time, right?
A long time, yeah.
Right. And we have it in multiple ways we do it. So the new technologies are not so great. I mean, it's interesting and something that I've been doing for a very long time. And so it's good that we're interested in it though. So you're right.
Yep.
Well, thank you guys for chiming in and listening, and the people that are going to listen to this later. Thank you for being part of our healthy healing community, and we encourage you to take serious look at your own health and nobody can do it for you. And but it's the most important thing that you'll ever do in your life is to respect and regard the miracle that you live in.
Thank you, guys.